Hello, thanks for attending this webinar today. So we are going to talk about what a quality ABA program looks like. There are many different pieces of information you can gather out there about this topic, but hopefully this will give you a good start. So if you see the first screen, we're going to be talking about what does your child need first, because before you actually begin an ABA program, you want to make sure that your child has everything they need. They need to be healthy. And in addition to being healthy, we need to make sure they're sleeping well. We want to make sure that they're well nourished and free of pain. And finally, we need to make sure that they're taught. And that is where this comes in, where ABA comes in. Assuming that you're doing all you can do to make your child healthy, you need to know how you can teach them. You've got to teach them many things in life. We teach our kids how to communicate. We teach them how to play. We teach them how to learn other skills. And this is where applied behavior analysis comes in, and it's what we're talking about today. Many people have heard lots of different myths about ABA, and I feel like I'm always constantly trying to clear these up and correct people. So I think this would be a great start to this presentation, is to clear these up right off the bat. The first one that I hear all the time is ABA produces robotic behavior. Many people have been told this, and I hear them even say they're going to avoid having a program because of this, that it's too strict and rigid of a program. But I think that it'd be a great time to clarify that and let you know that that is not what ABA is about. Many people have heard that you're forced to sit in a chair and a child will be crying for long periods of time. This is not a sign or an indication of a good ABA program. I think that's your first clue. It's not a good ABA program. But that said, there are times when, a behavior might need to be changed and something might need to be in place, and your child might not be, the happiest they could be. But the whole point in the program is that we will change things constantly to get them to that place. This is not, ABA is not a way to prohibit personalities from developing. It actually is a wonderful way to increase the output of your child's personality. I've seen many children that I've worked with that I didn't know their wonderful personality until I taught them the skills that they learned through their ABA program. So if you hear these things, a lot of these different myths are outdated and not appropriate anymore. Some people say that if a child hasn't received ABA by age 5, that it's too late. And that is not true either. Much of ABA is now really incidental teaching and natural environment teaching. We use a lot of positive reinforcement. And all of this is never too late to implement. An ABA program can make a meaningful difference in anyone's life, actually, at any time. There are research studies that show that it can make a significant difference in older children and even in the adults' lives. Another one that people talk about a lot is that ABA is only for kids with behavior problems. And it is not just for the kids who act up or the kids who are self-injurious or having large tantrums. I mean, we do address these issues within an ABA program, that we consider these behaviors to be observable and measurable acts. And so we can use ABA to help those. But we also use ABA to teach academics, social skills. We teach self-help problems. We even job training. I mean, the list goes on and on. It doesn't end. Actually, ABA works for everyone. If you think about it, companies that have employee incentive systems for their employees, all they're trying to do is change their employee behaviors to help the company run better, and that is using ABA. People who participate in programs like Weight Watchers, that is based upon ABA. So honestly, anything that deals with a behavior can be assisted with ABA. Okay, so then we have a couple more actually myths. One is that ABA doesn't teach how or why to do something, and it just trains a certain response. This is actually based on very mistaken ideas. And those ideas involve things like the child is only being trained to respond and not taught to be an independent thinker. It is true that all learning has some aspect of rote memorization. We all do. If you're in school or you're learning from your parents, no matter what, when you learn, you're learning to create habits. That's what you're doing. But this has nothing to do with ABA. It's just simply about how we learn. And much of our behavior choices in life are habits, and they are reactions, responses. Think about it. When it's time for you to take a shower, do you think about each step you need to do? I don't. When I go to take a shower, I'm not even thinking. I'm actually probably thinking about every other issue I have in my life while I'm just going through the motions of taking my shower. Because you learn and you practice and you're successful and you keep repeating the same behavior over and over, and then all of a sudden you don't have to think about it anymore. So it is true that in an ABA program, you can be successful in breaking down these simple tasks such as taking a shower and teaching them in small steps where they might not otherwise have been specifically taught, but the end goal really is the same. I also hear a lot about that ABA just uses food and prizes to bribe the child and that they get hooked on edible reinforcers. And I think this is actually another sign of an untrained behavior analyst in many cases. Not every case, but in many cases, they're not using the steps of conditioning new things to be effective reinforcers. That's one issue, but a lot of times that is where the child is, and that is what is appropriate for that child at that time. But a bribe is different than positive reinforcement. It's very, very hard to understand sometimes, and people can get into lots of debates about it. But when it really comes down to it, a bribe implies there's this negotiation before something takes place. So it's different than a reinforcer that is something that is delivered when someone is doing something successful. So I like to say, if you're wanting someone to do something, to start or do a new behavior, if they're not doing it and you've already told them to do that, and then you pull out the carrot and you dangle it and say, I'll give you this if you do it, that's bribery. Or if they have started a negative behavior that you're wanting to stop, they've already started it, and you ask them to stop and they don't stop, and then you dangle the carrot, that's also bribery. But this is all very different than an agreed upon contract before and delivering rewards. Also, while a food occasionally can be used, most of us as behavior analysts quickly do move to more neutral, natural forms of reinforcement, and there are procedures and techniques to help that occur. I also hear sometimes that ABA takes the childhood away from the child, and I really feel like nothing could be further from the truth. It is all about balance and how you make this happen. A good ABA program should provide positive things for the child. It should be productive and fun. It can be natural. I mean, if it's a program that I'm running, I want that child to enjoy every second and even enjoy their learning. And really, that's what we all do in our childhood, is we learn. Okay, so those were the myths. That means that's what ABA is not. But so then what is it? Because that's what everybody thought it was, right? Well, behavior analysis is a science. And that science studies how our environment or events in our life affect our behavior. You as a parent, what you need to know is that applied behavior analysis is using the understanding of the purpose for which the behavior occurs to address so many different issues. Like when I said ABA can be used in businesses or classrooms or even in a clinical setting, we're using these principles to change these behaviors that we want to change. Phobias, anxieties, and with autism to help these children learn new skills or replace any dangerous or concerning behaviors with more productive ones. So applied behavior analysis is the application of those behavior principles that have been developed over time, and you apply them to everyday situations that will end up helping to increase desired behaviors or decrease unwanted behaviors over time. It's actually the process of systematically applying interventions based on those principles. Interventions of positive reinforcement and negative reinforcement or extinction. These are all interventions, and they're based upon the principles of learning theory, which is the science of behavior. And they're basically applied to improve socially significant behaviors to a meaningful degree. That is very subjective, I know, and that it could be different for everybody, and that is the point, is it's very individualized. And we also want to make sure that we're demonstrating that those interventions that we're putting in place are actually responsible for the change in behavior. Based on a functional analysis, we are able to then design interventions that will produce change by manipulating the antecedents and the consequences of our behaviors. There are many different kinds, I guess you could say. I mean, kinds, theories behind approaches towards ABA. So you might have heard some of these, you might have not have heard of some of these, but they are all based on the science of behavior. You've got your DTT, the discrete trial teaching, precision teaching, verbal, which is a fluency teaching, verbal behavior, VB it's called many times, and this is where you're providing a framework to understand that language is built up of these different verbal operants that all have specific functions. And so we can teach new verbal operants, and we can, decrease some inappropriate ones. And then you've got NET, which is natural environment teaching. This is where you're using a systematic approach, but it's in a very natural setting. And it's taking advantage of natural opportunities for learning. And really, in a good program, all of these can be incorporated into a comprehensive program. Okay, so now that we kind of know what it is, we want to know what are we going to really use this for? And I've mentioned it a little bit, but I'm going to go into a little more detail. Really, it can be used for anything because anything that we do or say is a behavior. So as long as you can measure it and you can observe it, you can use ABA to modify it. An example, we might improve a child's academic abilities by teaching them how to add 1 plus 1, or self-help skills, such as putting on a shirt. Sometimes we want to decrease behaviors to improve things, and those are like sometimes the self-injurious behaviors or physical aggression of hitting and kicking. We might teach more functional living skills like sorting laundry. I even use the science of behavior when teaching parents to use these skills with their child. I'm using the science of behavior to teach parents the parenting skills. Athletic skills, riding a bike, when you're learning to become a better gymnast, and every time you learn a skill, we're using the science of behavior. I mentioned earlier Weight Watchers, and so an example, when you're trying to lose weight, you could increase your exercise, you could decrease your food consumption, and both of those things can be assisted through the principles of behavior. So in a general sense, we could look at treating things like alcoholism, parenting skills, academics, any of these skills using the science of behavior. Now, in terms of autism, many times ABA providers are working on improving socially significant behaviors for these children. And usually the areas we're focusing on are those areas of deficits and excesses, the ones that define autism. And if you think about it, I really like to explain this a lot. When we define autism, we define it by excesses and deficits in certain areas of communication, social interaction, and the self-stimulatory behaviors. And so if the DSM-4 is going to define and diagnose autism by behaviors, then to me and to a lot of other people, it makes sense to treat this where we don't have a cause, a fully cause that we know of, we don't have a cure. So if we're going to treat it, a great way to treat it would be to treat those specific behaviors through applied behavior analysis. So we've got communication, social skills, academics, you're learning, it's the study of learning, and then you've got even adaptive skills, things like the self-help, feeding, toileting. We've got many toilet training programs based upon the science of behavior. Now, all that is said is that's what it is. Okay, well, does that mean we can do that tomorrow? Does that mean you go to a sleepaway camp? Does that mean you go to a doctor? How does this work? I mean, how much do you need of this type of teaching? Well, my first thing I always say is that it's got to be individualized to the person. That is the most important thing. Every single individual is different. Now, research can show us that through studies that a minimum of 25 hours per week for 12 months of a year of that intensive behavior intervention is what's recommended to see improvement. So that's what research is supporting at this time, but that is not a end-all be-all. Still needs to be individualized. Like the Roth study, which was one of the first studies that really made a difference in autism and ABA being used for treatment of autism, is that they showed that approximately half of the children in their study were able to achieve typical development with an average of 40 hours per week for at least 2 years. Now, I think where we can really show what this means in terms of 25 hours, ABA involves a lot of repetition. There's a lot of systematic planning, and you've got to repeat and repeat. And then in order to generalize, that takes even more time. So there's no way you could achieve this in a couple hours. But I really recommend that a board-certified behavior analyst administers some sort of behavior assessment that guides their recommendation for the hours of intervention for the individual. And so it's based upon the results of an assessment that will determine how many hours is recommended. And even so, there's many different ways to actually make those hours happen. It's not one size fits all is definitely not the case. Now, where we come in and see all these differences is in that early intervention, intensive intervention time. Parents often intervene early and intervene a lot. You will hear starting before 3 and doing 40 hours a week. That these sometimes seem like the magical numbers that everybody thinks you have to have. But there is a science behind these recommendations as a general recommendation. And there's also a lot of common sense behind it too. So let's look at a visual here that will help us understand this a little bit. Thinking in terms of early intervention. Okay, so you have the blue line is your typically developing child, an example of the number of developmental skills that they're learning across their childhood. Okay. Also think about your delays that may be associated with an autism spectrum disorder diagnosis. Okay. So then you've got your red line, which is that. Okay. Now the children without the delay that are learning on the blue line, they are learning through observing and exposure naturally throughout their daily life. So they're basically on a constant upswing in terms of how many skills they're learning. But the children with autism spectrum disorder often do not learn in that same way. They have to be taught how to learn. And that is where good ABA can come in, because if we can teach how to learn, then they can start to learn these skills from their natural environment. But left without that intervention, they tend to lag behind their peers. So the difference in skill level is less when they are 2 than when they are 7 or 10. Because if they don't have the intervention, then the further they get in life, the more skills the typical kid's learning, and they're staying stagnant as the child with autism is. So as the actual number of skills that will need to be taught, they're going to grow larger as time goes on. So you can obviously intervene at any age. There's no age that you can't start changing behaviors. But to make the biggest difference, the earlier you intervene, the bigger difference you're going to see. And it's really the easier it's going to be to see those changes and have the chances of catching up as much as possible be increased. In terms of intensive intervention, let's look at a typical day in the life of a toddler. 2 or 3-year-old. Now, I have a 2.5-year-old, and so I'm going to break this down similar to her day. It's pretty easy after you see this of how 40 hours come into play. Okay? So you've got the day coming up. Here it is. The toddler wakes up. You've got a diaper change. You eat breakfast. You're playing. You go and change your diaper again. You clean up. All of this throughout the whole day, the child is learning. In every one of these scenarios, they are watching and they are seeing what happens in different scenarios, and they might not be able to put the words to it, but they're learning it. So that 40-hour a week, we need to get our students that aren't picking up from their natural environment, we've got to get them that same amount of hours to learn. They need that amount of time learning. We have to set that up. We have to actually teach it rather than the automatic learning that they do. So if you have almost 6 hours per day are spent in specific playing and learning time for the child, and that's without the learning they pick up even in the things that aren't play type, like the diaper change. I learn a lot in my when I eat lunch, as a child. So if you multiply that, even just the play and learn time, the 6 hours times 7 days a week, you're already at 40 hours a week. Sorry, kind of went too fast on that one. um, the other way that you get these hours as well, because I told you earlier there's a lot of different ways you can encounter these teaching hours. And part of it is that ABA should be incorporated into your natural daily life. So your typical kids are learning from their natural environment. Well, our children with the autism spectrum disorder could also learn from their natural daily life, but we have to incorporate specific principles and techniques to do that. And so it kind of becomes a way of life, really, that everyone in the family needs to understand ABA principles and how to apply them in the context of everything they do. Generalization and appropriate engagement at every moment is what's the most important. Taking advantage of every single opportunity. Um, I always like to talk about it as terms of also quality over quantity. So, or quality equal quantity. So it's not, you still want the repetition of the hours and the natural occurrences, but that quality is what's so important. And so given the goal that to appropriately engage and teach the child, it is important that everyone be aware of how the child learns, ways to encourage and participate, and be aware of any behavioral intervention too, because with behavioral intervention, it's really, really important that we're consistent. So I like to tell parents a lot that, any hours that you're sitting there in your natural environment implementing these procedures and principles, you can add those to your hours. And these hours can take place everywhere. I mean, there's not a single place that I couldn't find a way to provide ABA. Sessions can be in the home, they can be in a clinic, or even at school. They can be in a group setting even, out in the community. There's anywhere we can incorporate these principles. And this is what more resembles the typical child development and the way that they learn all day. Better generalization also teaches more pivotal behaviors. So those pivotal behaviors are those behaviors that are really central to wide areas of child functioning. And so when they're promoted, they're believed to produce improvement in so many non-targeted behaviors. To date, there have actually been 4 identified pivotal behaviors, including responding to multiple cues, motivation, self-management, and child self-initiations. And when these behaviors are enhanced, improvement in that self-learning and autonomy and generalization follows. Okay, so I talked about how you parents can get involved, how you have to be a big part of it. Well, what is your role? Parents and caregivers are going to play a critical role in the program. You are going to basically be the ones that are providing the insight that will help guide the program for your child, because really you know your child best, and we as parents, we know that. We know our children best. Now that doesn't mean that my child's teacher doesn't have good advice and recommendations and things that I need to listen to, but the good teacher, the good behavior consultant, is going to take into consideration the caregiver's insight when forming their recommendations and guiding the program. You also want continuity. You've got to continue to prompt and reinforce the child's behaviors through all of their daily activities. And you also might be tracking data. That's an important part, because a behavior analyst might not be able to be there to take that data every second of every day. Might not be a part of moments when we really need the data. But I think most of all, it's really important to trust in your BCBA, because they're the ones that they're going to take your insight and they're going to guide this appropriate program with their skills and expertise. And in order to see the most progress for your child, the more faith and trust you have in them, the better success you will see. I know I can honestly say, and this is very anecdotal data, but the few children that I have seen make the most progress, um, the one factor that each one of them have had in common is the trust their parents had in the program in the BCBA and the involvement that the parent had in the program. Now, in order to have that trust in your BCBA, you've got to find the right provider so that you can feel that trust. And that is now, the first thing in that is finding what ABA works, what approach, and they're not all the same. So many providers are going to be different in terms of their technique, in terms of the style, and even their skill levels and the children's ages that they work best with. And so these are all things that one isn't necessarily better than the other, but you've got to have the right one, the right fit. And what's so sad to me is sometimes somebody will have a bad experience and then they think that's what all ABA is. And I'm trying to always influence and convince people to try again, find where the weakness was and find a better provider for that, because it's the science of behavior. It's a proven science that works. And so just because something wasn't great with one provider is not ABA as a whole. And that goes back to that quality over quantity that I talked about. In addition, credentials of your BCBA are really not everything as either. I mean, you could have somebody that has the credentials and still not be excellent in their practice and applications. So the biggest thing is the individualization. Excuse me, I've had a cold for the last few days. But an example, too, of the different style differences is when I talked about those different approaches at the beginning, and I said verbal behavior, and I talked about naturalistic teaching. Some people might respond better to naturalistic teaching, and some people might respond better to a verbal behavior approach. Sometimes, to be honest, the same individual will respond differently to different approaches or programs at different times in their development. Or for one skill that they're learning, they might learn better through verbal behavior, and another skill they might need a more naturalistic teaching. So, it's really important to remember that you really want to make sure that you are individualizing. Again, one size does not fit all. So let's see. The first thing that you're going to do when getting started is you've got to get an assessment of your child's current skill level. And you want it to be as comprehensive as possible. This will include diagnostics and development and neuropsych, a lot of criterion referenced, and then even domain-specific assessments. There are some great behavior assessments out there. The ABLES, which is the assessment of basic language and learning skills. The VB MAP is another one. There's many different assessments, and they all have positives and negatives. There's not a perfect solution yet, or ever will there be, because we're all so different. But you can get a really great start, and what happens is these assessments, they give you a baseline for where your child's at. And then they help design the program, pretty much. Your child's strengths and their deficits or challenges help your team target which skills need to be targeted and which areas need to be addressed and take advantage of their strengths. And then we use this assessment as a basis for tracking how successful our program is. If you would like to have more information on assessments, there is a webinar on assessments that you can go to on YouTube and on the Johnson Center YouTube. Now, you need to have a qualified provider to actually administer these assessments. There is credentialing coordinated by the Behavior Analyst Certification Board, and there's a website you can go to find out more information. But like I said earlier, that's not everything. It's a minimum standard requirements. So you're going to have a very broad, diverse range of skills within behavior analysts. And it's a science of behavior, and think about how broad behavior is and how broad everything we do is. So, you're going to have people that are experts in certain areas as well. So for that purpose, you're going to want to interview potential BCBAs, not just take the first one you see. Find out what kind of experiences they have, what their strengths were, what kind of support do they have, what ages they've worked with, and have they worked with children that are similar in age to your child and level as your child. It's really important they constantly get continuing education as well, because things are always changing in our science. It is a science. And what we say is change and change again. But you also want to, the most thing I tell people too is consider the personality, the interpersonal communication of the BCBAs you interview. Because there might be some that are really, really great and have great skills, but they just might not click with you or your child for that matter. I mean, I usually recommend that you have the BCBA come in and spend time with your child, see how they interact. And also talk to them about how they collaborate with other professionals. I mean, if you're somebody who is, your child sees a speech pathologist and your child sees an OT and your child is on a diet, nutrition, you're going to want somebody that is going to work well with different disciplines. And so I think that's a very important part to check out as well, if that's important to you. You can ask to see a portfolio of the BCBA's work. Most people would have that. A sample of what their program looks like, what they do. You could definitely talk to past clients and families, because if you ask for a reference, people might give their professional references. But it's nice if they're going to be working with your family and your child that you've spoken to other families and clients of theirs. And also discuss their philosophy. Some behavior analysts are going to have an eclectic approach, and their philosophy is, as I said, an individualized program where we might take from the verbal behavior approach and we might take from a naturalistic approach. There might be some people that come in and they are strictly verbal behavior, and that's it. They don't do anything else. And you might want to be wary of that, because to me that is meaning that they're not individualizing for your child. Yes, they're probably pretty good at what they do, but if that's not going to be appropriate for your child, then it doesn't really matter how good they are at that. The best BCBAs will assess your child and choose the right technique and program to work with that child. Once you have your BCBA, you're going to also want to find therapists to implement the program that the BCBA actually designs. Some people have therapists that work for them, some behavior analysts, some do not. And parents will be told, you're going to have to find them yourselves, hire them yourselves, and these are all just different ways at this point in how ABA is working. And it's different, some things work better for different people. I know some parents who have called and they say specifically, I'm looking only for somebody who is going to provide me my therapist. And there are some people that say, I've worked with people before that gave me therapists and I couldn't have any say in it, and they're coming in my home. I really want somebody that works the way I want them to work with my child. So if you're hiring therapists yourself, you've got to keep a couple things in mind that costs do vary, and this is based upon where you live, where they're driving from, their skill level, and then with their training, is the BCBA going to pay for their training? Is it included? Do you have to pay for somebody that's new and novice to get trained? Who does the scheduling? Do you do the scheduling? Does the BCBA? And another thing to think about is nowadays that we have some, and it's different across the country, but in certain areas you have insurance coverage, in some areas you don't. But there's different criteria that are involved in that. And so if you're looking to have your insurance company cover your therapy, then you would probably need to see what those criteria are. It might be that they have to be behavior therapists that are um, employed by the BCBA. Um, when you hire people yourself, you've also got things to worry about with your taxes. There's many different things you need to look into because you're basically could be running a business out of your home. Um, but a good thing to think about when you're interviewing therapists is that just because they don't have the skills and the experience already does not mean they won't be a good therapist. Some of my best therapists have been people who have had no experience at all and they just had a knack for it, or they just clicked with that child and that family. So those are definitely just as important things to consider. So now you've gotten it started and you're going to have a program. What is that going to actually look like? Well, most of them should share some components. There should be definitely discrete trial teaching and generalization. Positive reinforcement is one of our main basis for increasing behaviors. Prompting and fading, outcome-based decision making, and consistency in all of those above. You really, in order for it to be a good ABA program, you should have a BCBA supervising it, and it should involve some form of training of the staff and family. Discrete trial teaching we've talked about a little bit, but to find out a little more about it, it really involves taking any skill and breaking it down into its smallest, most teachable moments, and teaching them separately. You can teach large skill deficits of social skills, communication, but you're going to identify the specific skills that make up those areas, and you're going to break those skills down and teach them. When you're teaching for generalization, you're going to be doing a little bit more. So you're going to start out where you're initially in less distracting environments, and that's during that acquisition phase of skills. And as a skill is mastered in acquisition, well then you're going to try to program for the generalization of that skill. You have got to basically make sure that the behavior is generalized across multiple environments. That they can do it independently and spontaneously. That's a big one. And a skill is not considered mastered until it can be demonstrated with different people in different environments with different items. So if you're, for example, if you're teaching that this is a dog to somebody, a picture, if this child could rotely memorize that this picture is a dog, but they didn't learn that with multiple different pictures of a dog, then you might not see the generalization of the skill, and then they didn't really learn the skill. And that's an example also, without that generalization, of where sometimes people think that we teach children to be robots. And you also want to make sure it's generalized over time and it's maintained. So you can't just teach a skill and then never, if they don't ever have to use it again, they're not going to maintain it. So it's really important that you're teaching skills that they're going to be able to then use when doing things in their natural environment, or use when they're still learning more skills. They're going to be prerequisites for future skills so that they can be maintained. Reinforcement. Reinforcement is a consequence that follows a behavior response. But the main thing that's important to know is that it's going to increase the likelihood of a future response of that behavior over time. Now we've got positive and negative reinforcement, and both of those are two different things, and a lot of people get mixed up on negative reinforcement. So positive reinforcement, you are following a behavior with a stimuli and the behavior increases. With negative reinforcement, you are removing a stimuli after the behavior. The behavior removes something that will then increase the behavior. An example of negative reinforcement, if somebody is in a work situation and they start to they're getting frustrated and they're hitting their head and we stop them from working, then most likely hitting the head is going to happen again next time that they want to stop working because it removed the demands, the work that they didn't want to do. So that's negative reinforcement. Again, I've said this before, but positive reinforcement is not bribery. All ABA programs do need to include a reinforcer assessment. Now, these are assessments that are reviewed over and over again, maybe even daily, maybe hourly, maybe minutes, all the time, to capture different changes in preference for an individual, because that's how we're going to continue to keep the motivation high. You've got to get creative sometimes. You know, effective reinforcers are things that are worth working for. They can be different for everyone and different at different times for one person even. You can look at it as this. Reinforcers are different than rewards. Reinforcers are rewards, but rewards are not necessarily reinforcers, because reinforcers are determined by that effect it has on the behavior, that it's going to increase the behavior. I could give an entire webinar just on reinforcement. Reinforcers should be built on items and activities that are motivating to a child. If not, if they're not motivating, if the ABA is not fun and it's not like a party and it's not something the child looks forward to, then there's something wrong. Then the therapist should be building rapport with the child by being a signal for reinforcement, that it means good things are going to happen when they see that therapist. So we always want to be working toward making play, obviously, then the reinforcement, because then that's where typical natural development is. The therapist should not just be this like Pez dispenser sitting there handing out, dispensing candy all day. Basically, therapy should be better because the person's there, not the person is a machine of delivery of items. Take a look at this little cartoon. What it's basically saying is, think about it. Our typical kids don't like to go to school, don't like to go to school. I don't want to go to school, right? They're always sick and want to stay home from school because they're not really learning through what's interesting to them and what's naturally fun for them. And so this kind of helps us remember to do that. So if you want more on reinforcement, you can definitely read the question and answers at the Johnson Center blog. What is reinforcement and where do I start? It's very important in an ABA program that you are using appropriate prompting strategies. Errorless teaching is something that has been very, very well recognized as effective, and it's very positive. It's basically beginning with your least intrusive prompt necessary for success and then fading those prompts out so that the child never has to err. That allows a child to be to make therapy more positive, to be fun, because they're constantly successful and they're learning through success. There's prompt hierarchies, which are most to least and least to most. But if you do least to most, then you're probably going to be allowing for more errors. And you're probably going to have to implement some sort of correction type procedure to teach that those errors are not what you're wanting. And I just want to make sure that we're clear that correction is not a prompt. A prompt is something that has to be at the same time or right after your cue or instruction, okay? So basically, if somebody is to, you say, touch the picture of the dog, and they touch the picture of the dog, and it's not the dog, it's a cat. If you say, no, that's a cat, let's try again, that's a correction. That's not a prompt. Even if you were to say, no, that's not a cat, but this is the dog, that's still a correction. The prompting would be where you say, find the picture of the dog, and then before they actually touch the dog, you are pointing to the dog. That's a cue for them so that they can be successful. There's multiple different types of prompting, but we want to remember that we're having to fade our prompts as quickly and systematically as possible. The reason for that is that it's very easy to become dependent on prompts. And if you're dependent on prompts, then it's harder to generalize and become independent because you're needing that assistance to, when I have somebody that says, oh, he can hang up his backpack at school, and he can, but every time he comes into school, I see the person say, go hang up your backpack. He's dependent on that. That is a prompt dependency. We want it to be they start to learn that entering the classroom is the signal for hanging up your backpack. Now, those different prompting types that I mentioned, the most intrusive one is a physical prompt, where you're actually guiding physically the student through the motions of the response you're wanting. That is the most invasive, most intrusive. There's also a verbal prompt, and this will help facilitate a correct response by giving some sort of vocal. And that's like the example of hang up your backpack every time they come in the door. That's the verbal prompt. Now, modeling is a visual type of prompt. It could be a vocal if you're trying to model a vocal behavior, but it's giving something for them to imitate. And so a lot of times we teach imitation programs really early on in an ABA program, and that is so we can use that skill of imitating to teach other skills. A modeling prompt isn't going to be effective if a student doesn't imitate. Position prompting is when you can position something in a way to promote the correct response. So if I want a student to touch a picture of a dog, then I might move that picture of the dog closer to them than the picture of the cat. It basically emphasizes that where the target item so that they're more likely to do that. Non-specific prompts, these can be visual, and they're things like pointing, or even a gesture is a prompt. So if I say, line up at the door, and I point to the door, or I do my come here with my hand waving, that's a prompt for them to follow the instruction. Even sometimes glancing at what you're wanting them to do is a prompt. Now, one of the most important aspects that makes ABA ABA, we have to definitely hit this, is database decision making. This is what sets ABA apart from almost every other intervention you will see, is that we have direct measurement and objective information. Okay, so it's not like an indirect measurement of maybe like a standardized test that they took. It is a direct measurement of something objective for that behavior that we can see, observe, and record data on the behavior, the actual behavior. And that is what's going to lead us to make our programming decisions, whether we want to continue working on this, if we need to make a change in it, or if we're ready to stop, is the data that shows whether it's been mastered. Any ABA intervention should be constantly evaluated for its effectiveness and done through the analysis of the collected data. And if it's not working, if the data is not showing that things are going the way they plan, it's not the child's fault. It's not what the child's doing wrong, but what can we, as the BCBA, as the therapist, what change can we make in the environment? Whether it's changing something that's going to promote a behavior or it's changing a consequence to provide more reinforcement, what can we do to make it more effective and to help the child be successful? This is basically what makes your behavior program so important in all of your intervention that you do. Um, it even actually can help with other interventions because the data that you take on whatever behaviors are being learned or taught or changed will help determine also the efficacy of many other treatments you're doing. For example, if you're going to eliminate something from your child's diet as a therapeutic intervention, work with your behavioral team, talk to your BCBA, and coordinate so that you can keep your therapist blinded or unaware of the new intervention. And then you can look at that data they're taking on the behavior they're working on and see if the intervention's being affected by the change in the child's diet. And that's just an example. For your supervision by a BCBA, make sure that your BCBA has the education and training and continuing education that's required. I wouldn't really recommend assessing the quality of a program without knowing that. Um, but the BCBA can effectively develop and implement appropriate assessment and intervention programs for you. One of the last things I want to mention about your ABA program is that a quality ABA program should extend beyond just the time the therapist comes and works with a child. I know we mentioned this earlier, but I want to make sure that it's clear that all who interact with a child should be aware and trained of the programs so that you can make sure that everybody is consistent and everybody's contributing to the generalization. So, what are we going to, and overall, what you need to know is that ABA is a positive experience. It is one of the best things you can do for your child and your child's development. Your BCBA should create a program that is individualized specifically for your child. And your BCBA should be respectful and inclusive of parents and caregivers' information. I want to thank everybody for your time and attention. Um, I think I'm going to stop now for a moment and um, look at some of the questions that might have, and then I will be back in a couple moments to answer some of those questions. Okay, I hope everybody can hear me. I'm back. I looked over some of the questions and I got some great questions actually. All very appropriate questions. So I'm excited to hopefully give your answers that you're looking for. The first question I got was whether I recommend in-home versus clinic based ABA programs. And I'm going to refer back to many of the things I've said throughout the slide of the individualization. It's really going to be individualized to your child and your family. I don't think either one is better than the other. There's positives and negatives to both. So, you know, some of the positives of in-home, I feel, are that your family, the parents, it's easier and I think you're going to get more training. You're going to see more of how to do things so that you're going to be able to help more with that generalization because you're not just going into a meeting or dropping your child off. You are a part of the whole thing, and so you have to learn it. I think that's a very big positive. The other thing is that your child starts to relate the therapy to life versus being in a center and going to this place to do these skills. So I've seen better generalization in lots of in-home programs. The But the downfall of that is that they don't get as much of that feeling of home being home because we all kind of, we need our place. I leave work every day and I get to go home. And if my home was my work, that might be more difficult. So it might involve more of an specific intent to arrange an environment where there is a little bit of a way they can have their break and their downtime in their home. Another thing involves your schedule of your family. I know if you have multiple kids and you're at home with your kids, it might be easier to do an in-home program because you can't constantly be taking your children and your all of everybody in the car, and sometimes it's far away, the clinic, and you end up spending half your day in the car when you could be using that time as learning time rather than drive time. So I really think that, but there's some people that I know go to work and they're like, well, how could I do an in-home program? I'm not there. My kid's in daycare all day. Okay, well, that might be a better place to do a center-based, a clinic. So I think it really depends on what's right for your family situation. Neither is better or worse. Um, okay, so I think that answered that one. Another question I got was, how do you decrease verbal stimming with ABA? And in general, self-stimulatory behavior is a very difficult thing to decrease. There isn't an intervention that just says this is what you do and it's going to go away. But self-stimulatory behavior increases or is highest when the individual is unengaged. So in turn, you want to engage them. The less downtime, the less stimming you might see. Another thing is the fewer skills they have and the less things they know how to do to occupy their time or to stimulate themselves, then the more time they're going to spend doing those, engaging in those self-stimulatory behaviors. So what we see is as a student progresses and is learning more, we usually see their self-stimulatory behaviors decrease as well. And in addition, whatever input or whatever stimulation they're getting from that self-stimulatory behavior, what behavior analysis, one of the greatest things is we can do a functional analysis to figure out what it is they're getting out of it, and we can teach them or provide them with an alternative for that. And that will then also help to decrease that self-stimulatory behavior. Okay, another question I had was about whether an ABLES or a VB-MAP assessment you should be dependent on that for your program. Your program should be designed from that or around that completely. It definitely is a great way to guide your program. I think it's a great starting point. I think it's a great measure of success and change, but it is not a person. So when you're, like we talked about, you're developing this individual and everything in their life, that can't be it all on a piece of paper. So I think what I would say is that yes, it should guide things and it should be an assistant, but it shouldn't be. I don't agree with a program that is 100% never steers or deviates from the VB-MAP or ABLES skills, because that is not individualizing for that child and for that individual. And I think that's a part of a good BCBA too. Somebody with great experience and great expertise will be able to use that to guide and not as the entire. And I think you'll see more of that when you have the less involvement you have via BCBA. I think the more you're going to see of that. And I know a lot of parents that I've heard want that because, I've had programs where I've heard parents say, well, it's just like the BCBA is flying by the seat of their pants, or it's not enough planning. They just seem like they're unorganized. But sometimes that's a BCBA who is truly basing their decisions and their programming on the data of what's occurring, and they're actually analyzing what is occurring versus following a piece of paper. Okay, another one that I got was, should you do additional ABA? Should the parent provide additional ABA hours when the child is already receiving 40 hours per week of ABA, maybe like at a clinic or with therapists? That goes into that part where I discussed about the parents being trained to naturally employ these techniques and these principles throughout the day. In that sense, I 100% think from the time you wake up until the time you go to bed, a parent should be providing ABA. That does not mean, though, that a parent should sit down at a table for 2 hours in a certain room and provide drills in addition to their 40 hours a week of that. So that's where I recommend it, is that you're constantly naturally employing these principles and consistently following the interventions for behavior. I think a parent should be a parent. And when I have a parent call me and say, well, I can't really afford therapists, and I'm at home, I want to be trained and do the ABA myself. I completely understand that, and if that is the only option, I can see how we would find a way to make it work. But I really, really think sometimes it takes away from a parent being able to be the parent, and every child needs a parent. And it's also hard for a parent to be objective. I can tell you I struggle with my own children on implementing what I know to do, because I'm not objective with my own children. I'm subjective. My emotions are involved. So in that sense, you could actually work against your team by trying to do these things. And my final question that I had was how you know when your child is being stretched too far, doing too much. And again, I hate to sound like a broken record, but again, it's your individual child. There are some times I see a kid get to the point where we're doing everything that we can to make it wonderful, fun, and reinforcing and positive, and by the child's behavior, we're seeing that they are stretched too far. You want to look at their behavior. You want to look at their health. Those are all things that we want to keep high and positive. And if those start to decrease, we might look at, are we doing too much? And I think that's just different for every child and every age and the type of program you have. I think 40 hours a week of a discrete trial program at a table is going to be too much for a 2-year-old. But 40 hours a week of a play-based naturalistic teaching in a positive environment might not be. So again, every bit of this goes back to a qualified, effective, board-certified behavior analyst supervising your program that is individualized for your child. So I think that is all that we have time today. We kind of went a little over, but thank you so much for your time and attention.